This recording will continue with Chapter 2, now Objective 4, define, pronounce, and spell body structure terms. So first we're looking at the suffix plasia. It means condition of formation, development, growth. Now, what they're wanting you to do here is just build medical terms from the following definitions using the suffix plasia. So your suffix will be plasia for all three of these. So, abnormal development. If you turn back to your prefix table, look at which prefix means abnormal. Again, you can always pause this at any time, but hopefully you saw that dys, D-Y-S, means abnormal. Then the second one, excessive development, which prefix means excessive. Again, hopefully you chose hyper. And then incomplete. Hopefully you chose hypo, which means incomplete. So when you complete the actual medical terms, you get dysplasia, hyperplasia, and hypoplasia. So this is what I was trying to explain earlier. When you have terms built from word parts, there's no reason to memorize the full term. If you just memorize dys is always painful, abnormal, difficult, or labored, you can answer any medical term. Once you know that hyper means above or excessive, you've got that for every medical term. And then hypo is always below, incomplete, deficient, or under. So again, don't focus on hypoplasia, focus on hypo and focus on plasia. That way you can answer any medical term out there or define any medical term out there then. Here is a picture of kidneys. So on the left you have a normal adrenal gland, on the right there's an excessive development or abnormal adrenal gland that sits on top of the kidney. So they're wanting you to define, or I'm sorry, not define, they want you to come up with the medical term that means excessive development. And we just did that. We learned that excessive, the prefix is hyper, and then for development, the suffix is plasia. So your answer should be hyperplasia. Alright, sometimes essential parts of a word are going to be omitted. So an ellipse is the practice of omitting an essential part of a word by common consent. So when you're looking at some of these definitions, in this case, blood is in parentheses. It's actually going to be omitted because it's just obvious that it's going to be there. So erythrocyte is a red blood cell. If you just said red cell, that would be fine also. And then leukocyte is a white blood cell. But again, if you just said white cell, that is fine, because if you define leukocyte, the definition is white cell. If you define erythrocyte, it's a red cell. And actually, if you start at the ending with cyte, it's cell red or cell white. But again, hopefully you understand that. Sometimes you just have to put them in the way that it flows easier. And so the word root for blood is just omitted because it's understood that it's there. So let's look at the table that has the body structure terms built from word parts. Again, built from word parts, prefix, suffix, word root. So they're easier to memorize. Again, don't focus on the full word, just focus on prefix, suffix, word root, and that way you'll know them for all future terms. So the first one, cytogenic, producing cells. Cytoid, resembling a cell. Cytology, study of cells. Cytoplasm, cell substance. So look at these first four terms. They all begin with cyto. Again, no matter what word it is, cyto will always be cell no matter what. So again, don't focus on cytogenic, focus on cyto and know in your mind that, okay, that means cell. Alright, continuing, dysplasia, abnormal development. Epithelial, pertaining to epithelium. Erythrocyte, red blood cell. Again, the RBC in parentheses is the abbreviation for erythrocyte or red blood cell. Erythrocytosis, increase in the number of red blood cells. Histology, study of tissue. Hyperplasia, excessive development, number of cells. Hypoplasia, incomplete development of an organ or tissue. Karyocyte, cell with a nucleus. Karyoplasm, substance of a nucleus. Leukocyte, or WBC, white blood cell. Leukocytosis, increase in the number of white blood cells. Lipoid, resembling fat. Myopathy, disease of the muscle. Neuroid, resembling a nerve. Organomegaly, enlargement of an organ. Somatic, pertaining to the body. Somatogenic, originating in the body. Somatopathy, disease of the body. Somatoplasm, body substance. Systemic, pertaining to a body system or the body as a whole. And visceral, pertaining to internal organs. Again, I cannot stress this enough. When you're learning terms built from word parts, if you just memorize the prefix, suffix, and word roots, you'll be fine. There's no reason to learn organomegaly. Once you know that megaly means enlargement and organo means organ, you've got it, okay? So just a quick question here. Which of the following means cell with a nucleus? Again, hopefully you know by now that cyte means cell. Well, all of them have cyte. Letter D is cyto, so that could be a trick question. We don't know yet. So which combining form or word part means nucleus? Again, flip back in your pages if you need to. Hopefully you found that karyo means nucleus, so your correct answer should be A, karyo.